good afternoon. This is called the graveyard shift. And I'm sure all of you are tired from a very long day. But the entire day we've been listening to this integrated human development. And we've talked about the dignity of the human person. And Fok Kwan talks about looking at a person as being unique. And John just talked about whole person and promoting the development of the whole person. For Agape Village, what we're going to be talking about is how have we done it? Have we gotten there yet? Are we at the cusp of greatness? And I must say, we're beginning this journey and there's much to do, all right? But my intention is to show how we have started this journey, you know, when we talk about trying to promote the development of the whole person. Now, I'm sure all of you have heard the adage of, it takes a village to raise a child, right? Well, it takes whole communities to be able to drive effective, sustainable impact in approaching poverty and driving impact on society. And that is why, really forms the foundation of why Agape Village was envisioned, right? And 3 years ago, we threw open the doors of Agape Village, all right? And in case you don't know, Agape Village is a Greek word that stands for unconditional love, all right? So where does Agape Village reside? In Lorong 8 Toa Payoh, in case you don't know, all right? And it's a holistic, integrated social service hub and it's an initiative of Caritas Singapore. Now, when you think about Agape Village, it serves all races. Can I get that? It serves all races, religions, nationalities. Can you hear me? Nationalities, beliefs, issues, and more importantly, people are served based on the fact that we have 14 of our member organizations are part of the Caritas family under one roof. And that is the key. Whole communities that come together to be able to serve. Each of them with their unique specialization, but together we can do many things. All right? And at the core of this, we are talking about the fact that we provide integrated case management, where we look at a case, a presenting issue, not as that issue alone, but how can we help that person, that client, holistically, beyond what we see as a start and in an initial conversation. So when we look at Agape Village, how do we serve? Cardinal Turkson talked about the fact that at the end of the day, we have to look at it from the standpoint of how we serve as a Catholic, as our faith, from the standpoint of our faith, spiritual formation. In fact, so did Archbishop at the beginning, talk about formation and the spirituality of serving. At the core of everything that we do is the Catholic ethos, and it's founded on the 5 principles of service based on the Catholic social teachings, all right? And as I mentioned, there are 14 member organizations in the Caritas family in here, all right? And all of them do phenomenal things. And I'm just going to very quickly read through this. We have ABLE. Okay, we have ABLE, and ABLE has a rehab and respite center and bookkeeping social enterprise in Agape Village. We have ACMI, who on Sunday does training programs for domestic workers. There are greater than 300, more than 300 of them coming into Agape to be, to take on various training programs. We have Boys Town that does a night outreach youth program, and Catholic Business Network that runs job fairs and does talks in Agape. Catholic Lawyers Guild that does pro bono legal clinics. Catholic Welfare Services, which, by the way, is our lead case manager and brings the various member organizations together in order to provide a integrated case management approach, right, to every presenting issue. Clarity Singapore, that provides deals with mental health issues and provides counseling and education, and specifically seeing a rise in youth mental health issues. Christian Family and Social Movement, building good Christian families. Family Life Society, that has a pregnancy hotline. And by the way, we have saved 17 babies last year and 15 babies so far this year. So let's give them a big hand. All right, since we were talking about abortion this morning, all right, and they do counseling in Agape. The Jesuit Refugee Service Singapore, that does overseas missions. Day Activity Center for special persons greater than or equal to 18 years from Monbury Oaks. Montfort Care Family Service Center has Child Protection Service and Young at Heart, and you had heard them just now. And the Society of St. Vincent de Paul, that does counseling, social work within Agape, and Mount Alvernia Outreach Clinic, that does has an outreach clinic, medical and dental clinic. Now, all of these 14 member organizations do wonderful work, and you can see how much their work has contributed to society as a whole. If you look at what ABLE is able to do, all right, and every one of them year on year is doing more and more within Agape Village. But is it good enough? Is it good enough? And that is the question. In the past 3 years, 1,000 cases has come through Agape Village. About 15% of those are integrated case management cases, which means more than one member organization has been involved, which means it is a collaborative effort. Can we do more? And what does an integrated case management situation look like? If someone comes in with a gambling addiction issue, all right, and they show it as and come as a presenting issue, the question is it only about the gambling addiction, or does it affect the family beyond that? The fact that the father's a gambler, does it affect the child? Does it affect the wife? You know, what other repercussions are there? Who else do we need to serve? And this really goes back to what it is we're saying, integrated human development. How do we bring communities together? How do we bring about collaboration and interdependence? By the way, in Agape, we also have the Alzheimer's Disease Association, Social Enterprise Cafe, and Family of Wisdom. We also have Club Rainbow. So we are not only bringing in Catholic organizations, we also non-Catholic organizations to come in and support what it is that we do and the needs of the people. We look at Alzheimer's and dementia as an important area. All right, but let's talk about some of the things that are great stories to tell. And this is a story that I have to congratulate Dr. Wong Swit Fern. Let's give her a big hand. She was in the elderly track just now. She shared about Share a Pot, so I will not steal the thunder, but for those who were not there, Share a Pot, we started this in June 2016 in Agape Village. It is a success story because we have really brought communities that are not part of the Catholic Church. Khoo Teck Puat Hospital, Yishun Care, National Healthcare Group was part of the external community that supported us. All right, this Share a Pot is really about building bones, building brawn, building brains, and building bonds through broth. That's a lot of bees there. All right, but the key really is at the end of the day, what are we trying to do? We are bringing in the elderly, and we are bringing in people who are really isolated, they are lonely, and most important, you know, they have some illness that prevents them from being active. So what do? We bring them in for exercise. They walk around, they do some exercise, there's a lot of social bonding, but most importantly, they have a healthy broth that is cooked by volunteers. Today we started with one Share a Pot, now we have two. We have registered about 400 seniors, and more importantly, it is manned by more than 60 active volunteers. Let's give a big hand, all right? And more importantly, what comes out of this? It takes a whole community. From the seniors who come in, Catholic Welfare Services is supporting them. Secondly, Clarity has been supporting them through education of mental health issues. Thirdly, we have Mount Alvernia, medical and dental clinic supporting the elderly and the seniors who come through. This is what that community looks like. Let's give a big hand to all of them. All right? And finally, I just want to...
This 1.5 months, I felt so invigorated, and when I go home, I feel so healthy. But for the past 2 weeks, I didn't come. So I feel so weak. Now I got back this.
Okay, sorry. This is Auntie Vimala. She's 81 years old, a retired teacher. She has a lot of presenting issues like, she has blood pressure issues. She has, and she's been taking a lot of medication. And she came to share a pot, and this is her story.
Village for the past, I think, 1.5 months, I felt so invigorated, and when I go home, I feel so healthy. But for the past 2 weeks, I didn't come, so I feel so weak. Now I got back this. I stay high. So let's all continue doing what we have to do. Then we'll be very healthy.
All right. Now, another good story of, coming together as a community is Madam Sia and Jasmine, who's 12 years old. Madam Sia is a widow, a low income, and Jasmine is just taking her PSLE. She's not doing well in school and has very, very low self-esteem. The family is helped by the Family Service Center and Social Service Office, but more importantly, even with money, it is not enough. If you recall, it's not about economics. All right? So what is happening? They have come to Caritas, and through the work that we do, all right, Acts 29, which is another one of our Caritas family, outside of the 14, there are 11 others outside. Acts 29 put together a guided learning program for Jasmine as part of support to Jasmine. All right? CWS provides an education bursary. But together, what we have done in Agape is looking at an initiative called Empowering Families Out of Poverty Project, where we try to bring together several member organizations, St. Vincent de Paul, Boys Town, Family Life Society, all right, together with Catholic Welfare Services as the lead case manager, to really look at how we can really help our families. And through this empowering project that we have, we've provided the education, we've provided the support to Jasmine and Madam Sia, and also we've journeyed with them. Today, what's happened is Jasmine is doing so much better in school. Her level of esteem has gone up tremendously. Madam Sia has gotten out of the funk that unfortunately has brought her down. And guess what? She's now feeling better because she feels that she is being supported and befriended and someone's journeying with her. And these are the stories that we can tell, and I'm sure there are many stories in this audience that we can hear. But at the core of everything that we do, we have to ask ourselves, how can we, and Cardinal talked about interrelatedness, he talked about, interconnectedness and anyway, I think it should be, I'll call it interdependence and collaboration. So how can we have a win-win, more of a win-win across the member organization, across all charities, because whole communities are what we need to bring about society, greater impact on society. And on that note, thank you very much.